Hello, everybody, and thank you for joining us and our podcast on mental wellness. My name is Tanya Andricks with Crossing Healthcare, and we're here today to have honest and very frank, practical conversations about topics that relate to mental health and mental wellness. We're all coming through a very difficult year in 2020, and now spring is upon us in 2021, and I think everyone is hopeful that life will improve and return to normal, and yet we're still finding ourselves grappling with these topics surrounding mental health and mental wellness. And so we want to talk about them. And today we're going to talk about eating disorders. And I am so excited that I am joined with three professionals from the Crossing Healthcare team that I know will bring a lot of great insight to this topic as we have this conversation and share the information with you. First, I'm joined by Charmaine Robertson Stoner. She is a licensed clinical social worker here at Crossing Healthcare, and she's our director, our chief director of all of our behavioral health services in the entire campus. I'm also joined by Jennifer Langner. Jennifer is a registered dietitian, and she is new to our team, and we're really grateful that she's here. She brings with her a lot of expertise that we know that she'll share with us to bring insight to this topic. And last, but certainly not least, we're joined by Allison Raiha. Allison is a registered dietitian, and she's also our director of all of our food and nutrition services here at Crossing Healthcare. Allison comes with a long-standing history of excellence. She brings creativity and insight to every project she ever does. And so I'm excited to talk about eating disorders with her today. So thanks for joining all of you. I want to start by sending this over to you, Jennifer, to talk about how common are eating disorders and what types of eating disorders do we typically see across our country? So what is sort of the state of eating disorders in the United States right now?
Yeah, absolutely. So from the current statistics, about 30 million people suffer from some form of an eating disorder. And from a clinical side, the three most common ones that we see are anorexia nervosa, bulimia, and binge eating disorder. So those are the three most common. There's definitely a wide range of eating disorders as well and different kinds, but those are the ones we typically see. And I think it's really interesting with eating disorders that only 70% of people who actually have an eating disorder will seek treatment. And I'm not sure if that's a fact of maybe just not a lot of knowledge about eating disorders and what they are, or even maybe that fear of bringing that up with your medical provider. So we can definitely talk a little bit about each of those eating disorders and the criteria to see if you may potentially be at risk for those.
Thank you, Jennifer. In your clinical experience, Charmaine, how common is it for our patients or patients in general to bring up an eating disorder, and who do they usually talk to about that when they do bring it up?
Sure. Yeah, I think eating disorders are extremely common. And oftentimes from a therapeutic standpoint, when we are seeing features or symptoms of an eating disorder, there's comorbidity with anxiety disorders as well. We know from the research and I think also what we know in terms of the limitations with the research is that there's a whole lot more research that needs to be done. But from the empirical evidence or studies that we do have, what we do know is that there's a significant correlation between sort of having an anxiety disorder and an eating disorder as well. So sometimes these things just kind of come out in a therapeutic setting. Maybe the person is there because I'm really struggling with test anxiety. And then suddenly, as we continue the conversation, there's more that's sort of happening. And I'm also struggling with my eating. And so it might not be, sort of the presenting concern, but it definitely impacts functioning.
You think one of the reasons behind that, Charmaine, might be that it's really hard to tell what an eating disorder is? We're in the sort of age where we're inundated with messages surrounding dieting and messages surrounding fad diets, which quite frankly, some are not always healthy. And some ask us to go long periods of time without eating, and it's called a diet. And others ask us to limit the types of food that we eat. Do you think that sometimes people don't even recognize what an eating disorder might be?
Absolutely. Tanya, I think that's a great point. I think it kind of takes us back to what's a disorder, just period, right? Like what's a disorder at the foundation? what we know about disorders is that, this is something that significantly impacts my functioning. So we're not talking about, today I ordered 2 large fries instead of the 1, or if we had still the supersize, I supersized it kind of thing. We're not talking about the once in a while kind of thing. We're talking about, this is sort of a part of my lifestyle. This is kind of a habit of sorts, right? It might be a compulsion or what have you. So I think we almost have to pause and talk about, what is a disorder? How does that impact my functioning? How does that impact my thinking? How does it impact my feelings? How do I feel? What do I feel about food? What's my relationship with food? Like, we kind of have to pause and talk about what our relationship is with food. Is food my go-to? Is that sort of my comfort? If I'm having a stressful day, does that look like me going home and eating until I choose to stop eating, or is it even a choice? Did I realize that the bag of chips, it's gone now? Or was I somewhere else? Meaning, we talked a few weeks ago about practicing mindfulness, and, so am I practicing mindful eating or not? And is this sort of a routine? So every day, if 5 days out of the work week, if I had 4 stressful days, is this my routine? To go home and sort of just eat or not eat, right? Or choose to not eat that day. I think that's important as well. So I think it's sort of stepping back, kind of having a conversation about the 3 types of eating disorders that Jennifer brought up. And what kind of behavior patterns do we typically see with those disorders?
So I think what I hear you say is there's definitely an emotional or behavioral component to eating disorders, but I think what makes these much more complicated is that there's also a very real physical impact on our physical health and our bodies and our well-being when you suffer from an eating disorder. Allison, I'm going to tag you with this because I know that with an eating disorder can come a lot of pretty significant physical ramifications. Do you want to expand on that? And then I think after we talk about that, maybe it would be helpful to break down these 3 eating disorders and talk about them on each level. So what are the physical ramifications and what might be the underpinning emotional ramifications of each one? So I think that's the direction we're going to go. But Allison, to start with, Charmaine did a really good job of talking about the emotional impacts. Talk to me about the general physical impacts of an eating disorder and why they're so important to discuss.
Well, I feel as if it's definitely multifaceted if you take a look at it. I think to preface the risks from the health risks, we really need to talk about diet habits, our behavioral health habits. And that's what makes this so difficult, because it's not something just a dietitian can to work with. It's multidisciplinary approach. And so I know we're going to get into that. But when we take a look from the medical or clinical side and the health risks, we take a look at, like, how does dieting impact your overall heart? How does it impact your overall bone health? How does it impact your overall gut health? And taking a look at that, depending on those diet habits and how risky those behaviors are, whether it's like disordered eating or a true eating disorder, when we take a look at that, we look at heart failure in a lot of cases with presenting patients that have had these diet habits, compulsive habits, restrictive behavior or binging behavior over the years. And so definitely it impacts the heart. It also impacts your bone health with osteoarthritis or porosis. And that can make a huge impact on overall health habits, as well as, your lifestyle and how you're living. And we always talk about the quantity versus the quality of the life. And when we look at quality of life, we have to take a look at the quantity of the food or lack thereof of food and how it impacts your overall life. When we take a look at, like, the gut health, a lot of times patients that present with disordered eating have symptoms of, like, irritable bowel syndrome, or what we call IBS. And it could get as extreme as like a gastric rupture. And those with binge eating disorders, and taking a look at how that impacts their overall health. To downright your teeth, the health of your teeth and how that can impact your overall health over time. We often see with anorexia or bulimia teeth decay and how it impacts their overall health and heart health as well. The teeth are tied to the heart, and infections can wreak havoc over the body. So it has a lot to do with overall health status and comorbidities.
Thank you, Allison. And I think that that's a really good summary. Can I assume that this is much like the other mental health sort of diagnoses that we've talked about in the past, and that really severity is again on a continuum, and that any time that you have, for example, and we'll start with anorexia, if you have disordered eating, I heard you start with disordered eating, and that sounds like that might be more mild to moderate symptoms, and it will span a continuum to a diagnosis of an eating disorder or anorexia nervosa. Would that be a correct statement to say that it's on a continuum of from mild to moderate to more severe? Is it like other mental health diagnosis or other diagnoses that we've talked about in the past? Jennifer, would that be the case?
Absolutely. With disordered eating, to start off with, you might see some patterns of skipping meals or maybe binging a meal, but it's not a continuum basis of an everyday thing. So that can definitely lead into a potential risk of an eating disorder. And disordered eating is still something to be cautious about, but from a severity standpoint, we don't want to cross that line to get into an actual diagnosed eating disorder.
So if we started with anorexia, maybe it would be helpful to start with you, Charmaine, and say, okay, when you diagnose anorexia from a behavioral health standpoint, what does that look like? What are the diagnostic criteria? And then we'll flip it over to you, Jennifer, and talk about, okay, well, what does that look like from a medical standpoint and from your dietary perspective?
Sure. Yeah. So really with anorexia, just, a way to summarize it is these are folks who really see themselves as being overweight. They see themselves as being overweight. And what we know is typically our perception is our reality, right? And so I think almost you kind of, that leads us potentially to body dysmorphia and these images that, well, look at this fat here, or, I am overweight. From a therapeutic standpoint, what we are doing a lot is cognitive behavioral therapy as well, right? So we're kind of pausing to think about, what are my thoughts, what are my feelings, and what are my subsequent behaviors, CBT, or cognitive behavioral therapy. So I think I'm overweight. I'm sure of it, it's sort of, and then I feel awful. I feel sad. I feel anxious. I feel overwhelmed. I feel worried about my weight, about my health, about my image, about how other people might perceive me, about how I perceive myself. And my action is I don't eat, or I avoid food, or, food is sort of it's the opposite of my goal, right? And so we kind of pause to go through this triangle of sorts of thinking, feelings, behavior, to really examine this person's relationship, not only with food, but how they see themselves. I think is really important for us to, to sort of pause and think about. Typically, a coexisting psychiatric condition with anorexia looks like a depression diagnosis, or an anxiety disorder, or, really it's obsessive behavioral OCD almost type tendencies. In fact, that's actually the most common type of anxiety disorder that corresponds with eating disorders. It's obsessive compulsive disorder. And then we also see substance use coexisting as well. So we sort of have to pause and look at that relationship, look at what symptoms or features that person might be presenting with, and really treat them both. That's also what we know. It's not the one or the other. It's kind of going back to what Allison noted earlier. It really is that multifaceted approach, is that interdisciplinary and team approach. So we're coming together with a medical provider, with the dietitians, with the counselor, with the psychiatrist potentially. And we're really kind of coming together with the patient at the center.
It sounds to me like the diagnosis of anorexia is pretty significant, and it's pretty serious, and it requires an interdisciplinary team approach because it can be incredibly dangerous from a physical standpoint, which I'm going to ask you to talk about a little bit, Jennifer. But in hearing you, I think what I hear you say, Charmaine, is that there could be a lot behind this, and it requires a lot of work to sort of redirect those thinking, feeling, behavior patterns that come along with it. That this is pretty significant and severe, or it can be. When you say that OCD is the most common condition, talk to me a little bit about how maybe this pandemic and this whole feeling of loss of control might play into a diagnosis of anorexia for an individual. How would it impact that individual? I assume it would make it worse, but what's your thoughts on that?
Sure. So a couple of thoughts. I think that, when we think about anxiety disorders, period, just to sort of break it down, it's going back to, it's that sense of a loss of control. It's that, again, what we talked about a few weeks ago, that fear of the what if. So it's really pending on the future. It's really kind of thinking pretty future focused. I think being in the midst of this pandemic, and there have been so many uncertainties. What is the future going to look like? We didn't know. Think about this time last year. I heard on the news this morning that today marked the first day of it sounds like the first death in the United States from COVID. Wow. And to think about how far we've come. Now, if I was functioning at a quote unquote typical level, period, that would still be pretty anxiety provoking, let alone if I've struggled with disordered eating or an eating disorder, right? So what we know is that there's, that the pandemic has probably exacerbated what was already maybe present, and or maybe new diagnoses have developed. Specifically, and not to jump ahead to binge eating, but with OCD, what we noticed is that folks start to develop kind of compulsive type rituals. So maybe it's like cutting their food up into like really tiny pieces. Maybe it's weighing their food, and or even binge eating, right? And so that's sort of what that looks like with that compulsion when we specifically talk about OCD and that correlation with being an anxiety disorder and that correlation with an eating disorder. So again, what we know from the research is that we work to treat them both. And again, that's if we walk in the door knowing that, we might be coming for one presenting concern, and then we learn about other things as well.
Thank you, Charmaine. Jennifer, I want to jump over to you and talk about sort of anorexia and what does that look like from your perspective, from a dietitian's perspective. What does that look like? How can you tell the difference between someone who is maybe trying to cut back or has very sort of stringent eating habits versus disordered eating versus a diagnosis of anorexia? And then maybe share some of the unique physical implications of that for someone who's suffering from that.
Absolutely. So with anorexia, we kind of look at it as almost like a self-imposed starvation state. So we maybe either don't eat for an extended period of time or reduce our calories significantly, some as low as 800 calories a day. And when we look at that amount of calories, that can be very detrimental on our health. And from a nutrition side, we would never recommend someone to be that low. So that's kind of where we notice that difference between an eating disorder versus maybe somebody who's just trying to be on a diet or live a healthier lifestyle. And from anorexia, some of the biggest things that we look for are dramatic weight loss. So what has your weight loss pattern been in the last couple months? Are you losing a significant amount of weight? We can do a nutrition-focused physical exam to see exactly how much body fat and muscle mass you have on, to see if there's any wasting there. Some other things too would be preoccupation with weight. So, it's a good question to ask, what is my weight? Where was I at last time? But is it one of those situations where you're so fixated on the weight and maybe gaining an ounce or a pound within a few months can be detrimental for that person? And that's where we really want to keep an eye on and have that conversation. Another thing too is making sure that we're dispelling those food myths. A lot of times patients with anorexia will have the mental thought of, I can't eat past 6 o'clock, or carbs are bad for me, or fat will cause me to be fat. So dispelling those food myths and going more towards the direction of, what does food do to your body? It nourishes your body. What's the vitamins that are in these foods that will help with your heart health, with your gut health, and your metabolism in general? And having that conversation early. From a nutrition component, from a dietary relationship, we want to make sure that we are never judgmental towards somebody with anorexia. And we definitely work very closely with the behavioral health and medical team. And our goal is to normalize eating again. And maybe it's adding a few foods that we're afraid of eating. You know, it could be as small as, I want to incorporate a piece of fruit at some point during the day, and slowly get away from those food fears and have that positive relationship back with food again. And the overall goal would be, yes, to gain weight, but really just making sure that patient is progressing at a normal rate for whatever the multidisciplinary team deems as appropriate. And when we look at that versus, again, like disordered eating, it could just be a conversation of, do you have a lot of stress in your life? Do you have a risk of emotional eating, to where you use that as a coping mechanism? And a lot of times people say, yes, I do. And we figure out good coping strategies between us and their mental health provider. And we figure out kind of a game plan with that. So really just being cautious and having those open conversations and just letting them know, I know you're going through a lot, but we are all here for you as a team to make sure that you can get to the goals that we want you to be at and that you want to be at.
Thank you. That was an excellent explanation. I just have one follow-up question. So if we're talking about anorexia, how would I as an individual know that it would be time for me to seek help from my medical or behavioral health provider? Or if I'm watching a child or a loved one in my home and I'm paying attention to how they're eating and I'm concerned, what is that point of, I need to seek some external or some outside help? And Allison, I'm gonna tag you with this question, if you don't mind. What do you think should be the tipping point to seek help for an individual? And when do you think it's time to have that conversation with somebody that you is in your circle, or a friend or a loved one?
I think at any point in time, it would be good to open up that conversation with your loved one or someone that you might be seeing these behaviors with. There's lots of great resources out there for like anorexia assessments, because this is one diagnosis that has a multitude of treatments and treatment centers and a great multidisciplinary approach to treatment. And so there are self-assessment quizzes out there. So the questions that they ask you is, do you struggle with an intense fear of gaining weight or becoming fat? That would be one question. Another question would be, do you significantly restrict your food intake? Do you experience an extreme disturbance in your body image or experience regular negative thoughts about your body? And have friends and family express concern about weight loss and eating habits? So that's a self-assessment quiz. But if you were to approach a family member or a loved one or someone that you would care about, just like in all the rest of the conversations that we have, I think coming with an open playing field, coming with care to that person, to softly or gently suggest that you're seeing changes in maybe their eating patterns or their relationship with food or others. And just to have that ability to conversate with them where they feel comfortable in having that conversation with you as well, so that you can kind of start to open some of these gates to get help if needed. And we've also talked a lot about risky behaviors, and that can be seen the same with food changes, and looking at your diet habits and the risky behaviors with that might lead up to disordered eating or even an eating disorder. So those gentle conversations, I think, are so important. And even just to as simply say, hey, can we talk about this? I know that with the pandemic, it's been very stressful. Depression and anxiety play a huge role in diet habits. And so that would be what I would suggest to do, is just to gently have that conversation with someone and see where it goes.
Thank you, Allison. And that sounds exactly like we've talked about with in all of our other conversations. If you're joining us now, we're here having a conversation about eating disorders and the impact of those on our mental wellness. And my name is Tanya Andricks, and I'm from Crossing Healthcare, and I'm joined with a wonderful team of professionals. Allison and Jennifer are both registered dietitians, and Charmaine is a licensed clinical social worker. And I think it's important to reiterate that just like in all of our other conversations, it's okay to have conversations with people who are your friends and your loved ones and bring up these tough topics. It's better in the long run. And I know oftentimes as friends and family, we worry that maybe we should mind our own business about things as personal as someone's diet habits. But at the end of the day, if you've seen a red flag, chances are it's time to have the conversation. And so thank you, Allison, for bringing that up. It doesn't sound like this is any different than substance use disorder or anxiety or depression. If you're worried about someone you care about, have the conversation, but just do it with love. So I'm grateful that that's the same sort of recommendation that we've given all along. I'm glad that we've had this conversation about anorexia. I think that that's an important one to discuss. And it's probably eating disorder that many of us think of first when we think about eating disorders and disordered eating. I want to talk a little bit about binge eating, because when you mentioned that that was one of the top three, I guess I was a little surprised or taken aback. When I think of eating disorders, I think of anorexia and bulimia. I don't necessarily think about binge eating. Jennifer, do you want to just explain what that is and sort of how we define that clinically?
Absolutely. So binge eating disorder is really defined by chaotic eating patterns outside of your normal way of eating without compensatory behavior. So without self-induced vomiting, the use of diuretics or laxatives. So it's really eating a large amount of food at one time. And from the prevalent side of binge eating disorder, about 2 to 5% of adults suffer with binge eating disorder, and 8% of those populations are considered to be obese. So it is definitely something that's coming more to the light now. In terms of like risk factors for binge eating disorder, some of the biggest ones are childhood obesity. So if you have struggled with obesity as a child, the risk of developing binge eating disorder is higher for those people. Body dissatisfaction is also a big sign or warning sign that we may be at risk for binge eating disorder. So not loving ourselves, not seeing ourselves as who we are, and maybe still being fixated on what our body should, quote unquote, look like. And poor self-esteem as well. Maybe not having that close social support or those people to be in your inner circle could put you at risk as well for developing binge eating. So from a nutritional side, we just really want to talk with these people about what is the proper way to balance your diet? How can we meal plan? And for a lot of people, maybe we're just not sure exactly how or where to start. So providing those conversations with patients. And also creating lifestyle changes, not just the next fad diet or the next in-trend way of dieting or exercising. It's figuring out something that's going to work well for you from a long-term lifestyle perspective, not only from a nutrition component, but also from an exercise piece. Figuring out from an exercise perspective, what are you going to like? What is something you want to wake up in the morning and say, I get to do this today, and I'm really excited. Not, I dread to go to the gym. I'm doing it because my dietitian or personal trainer told me I have to do. So having those positive conversations is very important.
Thank you, Jennifer. What might be some specific health risks unique to binge eating? Would it be other than obesity? And would that be the biggest health risk that you would be concerned about as it relates to binge eating?
Yeah, definitely obesity. Also, some things that could happen too are just joint pains. If you think about all the stress that you're putting on your body from that, it could potentially lead to joint pains. Some other conditions with your gastrointestinal tract as well. We're having to release a lot of hormones because of the foods that we're consuming, and the body's trying to metabolize all of it. So it could put some stress on your gastrointestinal tract as well. But also we've seen from the research, there is also an increased risk of substance abuse and utilizing substances as another form of coping. So that is definitely something we want to keep an eye on.
Thank you so much. Charmaine, when you think about binge eating from a behavioral health perspective, what are we usually dealing with here?
Sure. So from a behavioral health perspective, typically what we see from binge eating are sort of frequent episodes of really out of control eating, right? So this is sort of this compulsion to eat or take in more than what was designed to sort of take in, right? And so as you develop a plan with your care team and really have a lifestyle change, not really just, sort of a diet or I'm exercising solely just to lose weight or to get down to a certain weight, but to sort of live a healthier lifestyle. But outside of that, we're seeing a lack of control when it comes to sort of binge eating, right? One of the things that I think about related to binge eating is when we go back to childhood trauma. And I want to be very clear that it does not mean that everyone who has a binge eating disorder has experienced childhood trauma. What we do know, however, from the research is there's a significant correlation. So we briefly discussed the ACEs on here, or adverse childhood experiences. And I'm thinking back to Dr. Vincent Felitti and Dr. Bob Onda. They were the two that discovered the ACEs, which essentially means that there were really traumatic things that sort of happened during a person's childhood in high doses. So abuse, neglect, or household dysfunction in high doses. But how the ACEs actually started was Kaiser Permanente is a clinic on the West Coast. And a part of their role is to help folks who want to lose the weight. And Dr. Vincent Felitti had a patient come to him and she wanted to lose the weight. She lost the weight. The challenge was she gained 37 pounds back in 3 weeks. And so going back to so that's kind of mind blowing, right? But going back to your question to Allison, Tanya, you said, that compassion of sort of asking, and Allison saying at any point you can ask the person, hey, what's going on? And you have a physician who paused to say, hey, talk to me about what's going on in your life. And the patient responded, well, I don't know, but I think I'm sleep eating. And he's like, okay, that's a little different. Tell me more about that. And she says, well, I wake up and there's, when I wake up, there's food all over my counter. I don't remember eating it, but I live alone. So I must be sleep eating. And through further querying, that's sort of when Dr. Vincent Felitti discovered that she's, her relationship with food, again, going back and evaluating what is my relationship with food. Is it my enemy? Is it my best friend? Or is it, it's delicious and it keeps me alive kind of thing, that balance. Her relationship with food really began when she was around 10 years old, where she began overeating. It's also around the same time that her grandfather began molesting her. So there was sort of this incest history at the outset of 10 years old. Now fast forward and she's in her 30s and she struggled sort of with her weight her entire life, or binge eating, right? And then she lost the weight through this weight loss clinic and then gained a significant amount of pounds back within a very short time frame. So I think a couple of things to take from that. We have to, from a behavioral health standpoint, we're looking at control or lack thereof, but we're also saying, talk to me about your childhood. Talk to me about your relationship with food. What does that look like? It's not being afraid to ask the hard questions, because I think sometimes folks don't make that connection. And so if we don't ask, we also won't help them make that connection.
I feel like with binge eating, sometimes food could be soothing in that situation, and that it's almost as if it's some sort of a self-soothing thing. People might let me down, people might hurt me, food is my friend, or food. And then it goes to sort of, like all things, on a continuum, an extreme. And it's interesting that you bring that up. And I do remember the origination of the ACEs came with a weight loss clinic. And so I think that it really does highlight the fact that oftentimes when you have significant, anxiety or depression or mental health issues, many times disordered eating at the minimum can come along with those things. Thank you for that. Anything else we want to talk about before we switch gears to bulimia as it relates to binge eating? Anything else that maybe we haven't covered that we feel like would be important for those listening to hear when we talk about this topic?
I would love to input just some ideas for meal planning tips for what to do if you feel like you're struggling with binge eating disorder. And I think a lot of that is understanding our hunger and fullness cues. So knowing, am I sitting here in front of my TV because I'm bored, or am I upset over something? And really having a scale of almost 1 to 5, 1 being, I'm not really that hungry, I just want to eat something, versus 5 of maybe I haven't eaten in a while and I really am hungry. So asking yourselves those questions and allowing yourself after you eat, wait a couple of minutes, wait about 20 minutes to say, am I full or do I need to eat something more? I think understanding internally what's going on in our body is very important, and knowing what our own personal cues are is key.
Thank you so much, Jennifer. I'm really glad that you gave some practical tips. Do you recommend journaling those kinds of things? So it sounds like you've got a lot of really good recommendations of pausing before you eat, really doing an internal assessment, and then go ahead and eating. For binge eating, do you think journaling is that typically recommended by you and your team?
Absolutely. I think that having a food and mood journal is a great idea. Writing down maybe your mood right before you started eating. How am I feeling? What's going on in my life? Writing down what you eat. And then afterwards, am I satisfied after that meal? How do I personally feel inside? And we can go through that and say, okay, we noticed at this time, maybe you had a lot of stuff going on. Maybe you had work come up and you're stressed. And what can we do instead of that stress eating that's leading to binge eating? What can we do to cope with that? And I think that's where, again, that multidisciplinary approach comes in, to speak with your mental health provider or whoever is your closest support system to figure out those coping mechanisms.
And with anything else, a lot of people may not already have a mental health provider. Along the way, with all of the things that we've talked about, it's always okay to start with your family doctor, wouldn't you say? To start the conversation there and then go from there. And at the end, we'll talk about some resources. We'll add those to the show notes, and so that you can have resources from SAMHSA and other nationwide organizations to get help if you think that you have an eating disorder, disordered eating. Thank you, Jennifer, for the practical tips. I want to switch gears to the last disorder that we talked about, and that's bulimia. And I think that this one might be the hardest one to talk about. I think that this is highly stigmatized. I think that what we've seen over time is that anorexia has almost been glamorized by Hollywood and the media, and binge eating sort of comes along with being very normalized because many people struggle with eating patterns, and stress eating is sometimes normalized. But bulimia is one of those eating disorders that I think a lot of people have a lot of shame and typically will keep very much to themselves. Charmaine, talk to me a little bit about what is bulimia and what you see that's different with this eating disorder than maybe other ones that we've had a conversation about today.
Sure. Yeah. So bulimia is typically eating unusually large amounts of food and feeling a lack of control, essentially, over your eating. Typically, as Jennifer noted previously, the difference sort of here is that it's followed with purging or vomiting or what have you. There's also a significant amount of fear regarding gaining weight. So again, back to what you talked about. So maybe there's, this person binges, but then there's a sense of shame or guilt, or I think you hit it on the head when you said shame, because again, shame is a big part of the reason why I think we see such prevalence with this eating disorder. And again, regarding the lack of control over eating, I think it's important for us to sort of step back and revisit what we actually do have control over. Oftentimes when we feel sort of a lack of control, we catastrophize and we say, there's nothing that is going well and everything is sort of outside of my control. And We use the alls or the nothings and the always and the never and those kind of things, right? And we believe ourselves. We don't have a problem kind of believing the negative things about ourselves usually. So I think it's important to step back. And if I'm struggling to do this independently, that's when a support system comes in. That's when a therapist comes in. That's when meeting with my medical provider comes in, or my dietitian or what have you, and really sort of reevaluate the things that are going well or fairly well. So maybe I'm struggling with my eating, but I maintained employment throughout this pandemic, and wow, that's huge, or I'm going to be more intentional about journaling. Again, I like how you mentioned, Jennifer, not just about the food journal, but the mood journal as well. And so maybe those two things coexist. And I'm writing down, I'm documenting my day with food and also how I was feeling in that moment. Those are things that, believe it or not, they're tiny, but I do have control over those things. And then I can go back and kind of review them as well, and allow that to guide me towards what my next meal might be, or my relationship with food.
Thank you, Charmaine. Jennifer, can you tell me a little bit about what bulimia looks like from a dietary standpoint? And it feels like this particular eating disorder could be pretty dangerous. Can you talk to me a little bit about the health risks then associated with bulimia?
Absolutely. So kind of like what Charmaine said, again, it's eating a large amount of food followed by those compensatory measures. And especially from a health risk standpoint, if we think about, the use of diuretics or laxatives, or again, self-induced vomiting, that can put a lot of pressure on our esophagus, on our teeth, if we're constantly purging. And it could also potentially lead to heart failure and pancreatitis and a lot of other conditions as well. So it is a very severe disorder. And I think the other thing to bring up too with bulimia is that not only do we have a sense of loss of control over food, but also from a social perspective. Maybe we're worrying about, if we go out to eat somewhere, when are we going to be able to purge? Or maybe being in isolation, we're telling our friends, no, I just ate, I'm perfectly fine. And that sense of, when am I going to get rid of this food I just ate? When is that going to happen? And that can lead to other, symptoms of depression or whatever it may be. And again, with bulimia, it's very similar to binge eating, to where there is low self-esteem. And a lot of patients who are bulimic are actually at a normal weight. And so normalizing weight fluctuations, and it's okay to gain a few ounces or gain a pound over a month span. And also talking about the recovery process. So once we're able to normalize eating, maybe we get on a normal eating schedule of 3 meals a day or eating every 4 hours. Sometimes we have recovery side effects related to that, like fluid retention or bloating or constipation. And all of these are very normal. So having that conversation with patients and saying, hey, this might happen. It's okay. It's okay that maybe 2 ounces you gained is a fluid retention. You're holding on to more fluid. And again, from a nutritional standpoint, what we would do as dietitians is journaling. Journaling is a great avenue for patients, having those regularly scheduled and balanced meal times to know I'm going to have my 3 meals a day, or maybe 4 to 5 meals, smaller meals per day. And what is the component of those? Is it all refined carbohydrates, or are we getting a good mix of protein and grains and vegetables to balance everything that we need?
Thank you, Jennifer. I think that this has been such a powerful conversation. I think that we're inundated oftentimes with messages surrounding diet and health and wellness. And I think that sometimes that morphs into, in many people's minds, a normalization of disordered eating. And so I think just defining it is really, really powerful to know, okay, what is the difference between something that's disordered and not? And what I hear you say, Charmaine, is that, when it's disordered is when it's impacting your life and your health. That's the moment it becomes, maybe a problematic coping mechanism to something of significant more concerned. Would you say that that's correct, Charmaine?
Absolutely. Yeah. When we're talking about a significant implication or impact on my life, now it's a good time to pause. I think sometimes that's the question, right? Like, how do I know I've struggled some, but we do really well at rationalizing our behaviors at times. So when is a good time to sort of pause and say, right now is probably a good time to seek support or to be transparent about my struggles, my private struggles. Again, understanding, I think going back to the prevalence of how prevalent eating disorders are, there was a study that said a 2004 study found that 2/3 of people with eating disorders, again, have co-occurring anxiety disorders as well. And so how prevalent are eating disorders and anxiety disorders and depressive disorders? They are very common. And I think when we go back to sort of normalizing those experiences, like Jennifer noted, hopefully it adds to the person feeling less shame and feeling more of a motivation to receive help or support, because we all need it at some point. So yeah, I think that's really what I would add. I think that, again, from a behavioral health perspective, some of the very practical things that we might talk about is, you mentioned it, Tanya, it's sort of food is my friend. Food doesn't let me down. Food is there for me. It's good. It's predictable for the most part. And so I think it's going back to like naming food, identify my relationship with food, owning that it's important, it's vital, but it's not everything. It's not my everything. It doesn't have to be like my source for everything, for happiness, for joy, for pleasure, for companionship, for connection, right? Like, let's discuss what relationship I sort of have with food and let it be that. In sessions at time, we've also talked about really working to kind of retrain our palate. And so, our dietitians really do a great job here at Crossing of like putting on demonstrations, right? So like the most recent one was shake off the salt or what have you, but just being more intentional about our food choices, right? The slogan of, what is it? Making it the healthy choice, the easy choice. Allison can say that better. But again, I think it's pausing to be a bit more intentional and mindful. It's also a good time to just sort of not eat while I'm driving. And that's so much easier said than done because we lead busy lives. But to savor the food, but to not fall in love with it where it becomes my absolute everything and nothing else can sort of fill that void.
I think we have been able to give a lot of really positive practical tips on how to know when we have an eating disorder or disordered eating. Certainly always have a compassionate, caring conversation with a friend or loved one that you believe might be struggling. It sounds like mindful eating, things like food and mood journaling are all great places to start. You can always call your family doctor and start there if you have a concern. I think before we close out, I want to make sure that Allison, you and Jennifer have one last opportunity to share any closing thoughts that you think those listening to this podcast would benefit from when we talk about this conversation topic of eating disorders. Allison, I'll let you go first.
Well, I just kind of want to normalize that many people have with disordered eating or an eating disorder. The pandemic has definitely changed the outlook of how we react to life and how we cope with life. And it's been particularly devastating for those with anxiety disorder or depressive disorders. And the correlation between that and diet habits are so closely intertwined. And so when we take a look at this, and we talked about risky behaviors, but with the eating patterns, it really is important to realize that isolation has played a role in this. That not only isolation, but restriction of activities. People have felt very alone in that conversation of how food makes me feel, or I can always turn to food to cope with those feelings, I think has been exacerbated through this pandemic. So many people are probably seeing disordered eating patterns exacerbate over time. And then you take a look at like how media plays a role, not only just in self-esteem, but also in, the messages that we're hearing and the things that we're seeing. Taking a look at different eating disorders and looking at, like, is the food that I'm going to eat give me a virus or something that's going to make me sick, whether it's the coronavirus or COVID-19 or another illness, and having those scary thoughts impact that even further, I think is really important. My last hope for people that maybe are feeling like these risky behaviors are making an impact on their overall health, their current weight, and just their thought process with it. If you start to see that a lot of my time is spent focused on my overall weight and unhealthy weight, and a lot of my life is focused around food, that we do reach out for some help, and that we do look to our medical provider to get started in that process. Having that medical provider with the registered dietitian and the counselor there to look at every single avenue or angle, and really look at, like, even motivational interviewing, taking a look at, like, what's worked in the past. How does my past impact my future? If I continued with these behaviors, how does my overall health look like a year from now, 3 years from now, 5 years from now? And taking a look at making those simple changes to your diet or your lifestyle so that you can move forward in the right direction. And so those are kind of the things that I would like to end that conversation with, just to normalize this for folks. And take a look at just overall health in general, and how do we move forward in light of the pandemic that we've been living with for the past year, or beyond the pandemic, and looking towards our future and having it be more hopeful and more bright.
Really glad that you took the time to normalize eating disordered and disordered eating. I think that a lot of people suffer from these kinds of challenges as it relates to eating. And I think it's important to understand that you're not alone and you should seek help. And I'm really glad that you highlighted that. Jennifer, any final closing comments that you'd like to share with those listening surrounding this topic?
Absolutely. I think just piggybacking off of what both of you said is saying that speaking to somebody, whether it is your medical provider, your dietitian, we will never judge you. And I think that's one comment I get a lot of: you're disappointed, or this is embarrassing for me. It's not embarrassing. It's a thing that we need to work through, and we will never judge you from a healthcare field on stuff that you're going through. So having those open and honest conversations. And even if you think something is just different with your eating pattern or your exercise pattern, speaking up, because you'll never know unless you ask those important questions. And just loving yourself. I know that may seem like a corny thing to say, but love your body, love yourself, because we're lucky to be living in this life, and we should be proud of who we are and standing up for ourselves.
Thank you, Jennifer. I think that it's so important to understand that if you do have a challenge or a struggle with your eating, you have concerns, it's always okay to seek help from your medical provider. And again, to your point, Jennifer, we're not here to judge, we're here to help. And I think that that is something that you see throughout healthcare surrounding this topic. Thank you again for joining us today. My name is Tanya Andricks. This is Crossing Healthcare, and this is our series on mental wellness. I hope you have a wonderful day and be well.